Hi all, welcome to another video. In this video, I'm going to explain in detail about Russian current. So coming to the contents, by the end of this video, you will be able to understand about the introduction, parameters, physiological effects, therapeutic effects, indications and contraindications of Russian current. So coming to the introduction, so the Russian current was developed by Dr. Yakov Kots in 1997. He was a Russian physiologist for increasing the muscle force that increases the maximum voluntary contraction. So this class of current generators was developed in Canada and the US after the Russian scientist Yakov M. Kots presented a seminar on the use of these electrical muscular stimulators to augment the strength gain. So mainly this Russian current was introduced by this person that is known as Yakov Kots for increasing the muscle strength. So these stimulators developed after this presentation were termed as Russian current generators. These parameters specially intended for quadricep strengthening in Russian athletes. Russian Olympic team were using it in addition to their usual training method. So Russian current or Russian generators was introduced by Yakov Kots as a result of as an adjunct to your normal muscle strengthening protocol used by the Russian Olympic team. So it was used as an adjunct technique to improve the muscle strengthening. So this is an intermittent alternating sinusoidal current with a carrier frequency of 2500 hertz, that is 2.5 kilohertz. So by this you can able to understand that this is a medium frequency current. Russian current is a medium frequency current. So Russian current is a sinusoidal waveform delivered in bursts or a series of pulses. So hence it is known as medium frequency burst alternative current. So and other term for this Russian current is also known as tone burst current. So its use led to significant increase in the muscle strength, that is 30 to 40% of gain apart from the normal strengthening protocol. So these stimulators have evolved and presently deliver a medium frequency polyphasic alternative current waveform, and the pulse can be varied from 500 to 250 microseconds. The phase duration will be one half of the pulse duration, that is 25 to 125 microseconds. As the pulse frequency increases, the pulse duration decreases. So pulse frequency is inversely proportional to your pulse duration. Pulse frequency increases means pulse duration will be getting decreased. And there are two basic waveforms in Russian current. First one is your sine wave or sinusoidal wave. Second one is your square wave. So square wave cycle, which is having a fixed intra-pulse interval. In 1970, claims were published that this 2500 Hz medium frequency interrupted current could be used to generate greater muscle force than a maximum voluntary contraction. So the muscular force produced by the normal voluntary contraction is less comparing with the usage of this Russian current. So Russian current produces greater muscle force than a maximum voluntary contraction. Although it is a medium frequency current, the nerves are stimulated because it is interrupted to give a low frequency stimulation of 50 Hz. So it has a medium frequency effect as well as a low frequency effect. So the nerves will be stimulated because of the low frequency effect also. The pulsing or bursting is at a low frequency, and as a result the nerves will respond. The current consists of 2500 Hz evenly alternating medium frequency applied as a series of separate bursts having a burst duration of 10 milliseconds with a pulse duration of 0.2 milliseconds, which is interspersed with a 10 milliseconds rest period when no current flows. It producing 50 bursts per second, which is in fact like the low frequency Faraday type pulse at 50 Hz. So this is having a low frequency effect also, because of that the nerves will be getting responded to this sort of current. So this is the waveform diagram of the Russian current. So with this particular diagram, which I will be explaining in the upcoming slides. So Russian stimulation was probably the earliest name for this stimulation type. Several multimodal stimulation devices include it as one of their options. Burst mode alternating current (BMAC) is a more generic and more recently employed term, which is probably preferable. Using a 2500 Hz stimulation at 10 milliseconds means that the effective muscle stimulation is at 50 Hz. The theoretical basis for the use of this current is that maximum electrical stimulation can cause nearly all motor units in a muscle to contract synchronously, something that cannot be achieved in a voluntary contraction. So this makes it more useful than the normal voluntary contraction. So it is this particular machine as producing more muscle contraction comparing with the normal voluntary contraction. So this produces stronger muscle contraction and greater muscular hypertrophy. And the electrode placement should be over the muscle belly. The continuous versus burst protocols were evaluated. That is, continuous is 2500 hertz or 2500 hertz burst at 10 milliseconds intervals. There were no significant difference. There were no significant difference in the maximum force generated, but the burst mode generated the same result with less current having been applied, that is 50% less. So comparing with the continuous and burst protocols, the burst protocol or burst mode has generated the same result as that of a continuous mode with less current, having nearly 50% less current. The recommendation is therefore that the stimulation should be applied with a 2500 Hz carrier medium frequency sinusoidal alternating current burst at 50 Hz, that is 10 milliseconds of on to 10 milliseconds of off at a maximum tolerable level. The researchers concluded that 2500 Hz, that is 2.5 kilohertz, was the most effective frequency at which to stimulate the muscle tissue. That is 100 Hz or 1 kilohertz was more effective for nerve trunk stimulation, stimulating for a 10-second duration. So this is the diagram. Alternative 10 milliseconds of on and 10 milliseconds of off. So on period is 10 millisecond and off period is 10 milliseconds, which is having a carrier frequency of 2500 Hz. So this is a polyphasic sinusoidal curve, alternative current. Coming to the parameters, the carrier frequency is 2500 Hz, that is 2.5 kilohertz. The waveform is a polyphasic sinusoidal waveform. The current amplitude, the maximum current amplitude is 100 milliampere, but the clinically used as 70 milliampere. The burst frequency is 50 Hz. Burst duration is 10 milliseconds. On or off ratio is the ratio between the time of stimulation and time of no stimulation. So it was set at 10 millisecond on to 10 millisecond off. The duty cycle, the Russian current is producing a duty cycle of 50%. So that is 10 millisecond on means 10 millisecond off. That is 50% duty cycle. Duty cycle means the ratio of on period to off period. So ramp up and down. Setting the ramp time is very important to evoke contraction similar to muscle contraction. It is a gradual increase of intensity with associated gradual increase of muscle contraction. So it is 1 to 2 seconds in Russian current. So the ramp up and ramp down is 1 to 2 seconds. So the resulting stimulation pattern from this work includes the base frequency, that is 2500 Hz or 2.5 kilohertz, burst duration at 50 Hz, 10 millisecond on to 10 millisecond off, that is 50% of your duty cycle, stimulus delivered just for 10 seconds, rest period of 50 seconds, repeated 10 cycles, that is 10 is to 50 is to 10. This is the normal protocol of Russian current. We will be giving the stimulation for 10 seconds, we will be giving a rest period for 50 seconds, and this will be repeated for 10 times, that is repeated 10 cycles. And this will be given daily at a maximum tolerable intensity to the athletes. So the training protocol, which I just briefly explained in the previous slide, the widely and the most popularly non-clinical protocol for Russian current is 10 is to 50 is to 10. That is 10 muscle contraction lasting for 10 seconds and off period of no contraction for 50 seconds. And this cycle will be repeated for 10 times. That is 10 seconds on, 50 seconds off. And this protocol will be repeated for 10 times. That is 10 is to 50 is to 10. This is the important protocol which is used in the Russian current. And the duration frequency of time, the recommended duration of treatment is 10 minutes, daily once per week for several weeks. That is, this in order to have a better strength gain, this should be followed for at least 3 to 6 months. Daily, we need to follow this daily, one at a time, one section per day for 3 to 6 months. We need to use this modality. Electrode placement. So electrode should be placed parallel to the direction of the muscle fibers. So coming to the physiological effects. So this is a medium frequency modulated sinusoidal current. Russian current is a medium frequency modulated sinusoidal current, and which causes the depolarization of sensory and motor nerve fibers synchronously, and the motor nerve depolarization induces the activation of the fast type 2 motor units. Because of the medium frequency sinusoidal current, the type 2 fast motor units are recruited, and this may produce high level electrically evoked muscle contraction, and the contraction will be against the external load and finally leads to muscle strengthening. So this is the basic physiological effect of this Russian current or sinusoidal current. And coming to the therapeutic effects, the therapeutic effects includes to improve the muscle strength, to reduce the muscle spasm, to reduce the edema due to lack of muscle for contraction, and to reduce pain. So these are the protocols for the various therapeutic effects. So in order to improve the muscle strength, we will be using a tetanic muscle contraction. The amplitude will be a tetanic muscle contraction form. And the pulse rate or burst frequency will be 50 to 70 hertz. And the pulse duration will be 150 to 200 microseconds. And this apply the current during the volitionally, that is isometrics in different range of motion, slow speed isokinetic, and short arc movements. And the normal protocol, that is 10 seconds on, 50 seconds off for 10 times. Is this rule will be applied in order to improve the muscle strength. So in order to improve the muscle strength, or in order to improve the muscle strength gain, we will be using this normal Russian protocol, that is 10 seconds on, 50 seconds off, and this cycle will be repeated for 10 times. In order to reduce the muscle spasm, we will be using the same tetanic muscle contraction up to the patient's tolerance, and the burst frequency or pulse rate will be 50 to 70 hertz, and the pulse duration will be 50 to 175 microseconds. Stimulation is applied to provide the brief muscle isometric contractions. On time will be 5 to 12 seconds on time and 10 to 15 seconds of off time. And the third therapeutic effect is here to reduce the edema. So you can they will be giving the small visible muscle contraction, and the pulse rate or burst frequency will be 35 to 50 hertz. The pulse duration will be around 400 microseconds, and the on or off time will be 1 to 2 seconds on and 1 to 2 seconds off. So in order to promote the muscle pumping effect, the treatment time will be 10 to 15 minutes per section, and can be used more than once section per day. So 1 to 2 times per day can be used. So these are the therapeutic effects and their protocols which should be followed. And coming to the indications and contraindications, the only indication for the use of Russian current was introduced by Yakov Kots in 1977 is to strengthen the muscular system of healthy and athletic persons. The main indication for this Russian current is just for your improving the muscle strength, and this can be also used after knee ligament surgery, after arthroscopic knee surgeries, following the ligament sprain to improve the quadriceps force during immobilization, and after casting, and for the reducing the muscle spasm, we can use this type of Russian current generators. And the contraindications is over the anterior cervical area, over the lumbar or abdominal area during the pregnancy, and over hemorrhagic area, over neoplastic area, over metallic and electronic implants, and over area of impaired skin sensations. We should not use this type of Russian current generators over these particular areas. So this is the Russian current diagram. So you can see here. So this is a polyphasic wave. So polyphasic sinusoidal curve, and which is having a frequency of carrier frequency of 2500 hertz. That is 2500 times per second, pulses per second. And you can see here. So this is the pulse duration, 400 microseconds, and the 2 divided by 2, that is 200 microseconds. That is your phase duration. And you will be having a 10 milliseconds of on and 10 milliseconds of off. So ratio of on off period is 1 to 150% of duty cycle will be there. So 10 millisecond on means 10 millisecond off. That is the interburst interval. The interval between, that is the rest period. Interburst interval means your rest period. That will be 10 milliseconds. The ratio of on period to off period is your duty cycle. That will be 50%. 1 by 2. That is your 50% of duty cycle, and 10 milliseconds of on period, 10 milliseconds of off period. So this is all about the diagrammatic representation or the waveforms of your Russian current. So this is the same protocol: 10 milliseconds on, 10 milliseconds off. It is having a burst frequency of 50 hertz, the phase duration of 200 microseconds. So you can see here, this is the phase duration and this is the pulse duration. So pulse duration alternating sinusoidal waveform. So in order to summarize, so this is a medium frequency current. Russian current is a 2500 hertz evenly alternative sinusoidal medium frequency current, and this is applied as a series of burst model, and this is why it is known as tone burst current. Russian current is otherwise known as tone burst current. And coming to the current amplitude, burst frequency, burst duration, on or off ratio, duty cycle, ramp up and ramp down, training protocol, duration, frequency, electrode placement. So these are the different parameters which I will be just summarizing in the next slide. And same for your Physiological effect is mainly your muscle strengthening, and therapeutic effect in order to improve your muscle strength, in order to reduce your muscle spasm, and in order to reduce your pain and to reduce your edema. So these are the various therapeutic effects and indication and contraindication. Mainly indication mainly for your muscle strengthening and to reduce your muscle spasm. And after post surgery or post edema or post cast immobilization, we can use these Russian current generators. In contraindication over these particular areas, over the metallic implants, over the abdomen region, or during the pregnancies, like over tumor regions. So it should not be used for hemorrhagic conditions, unconscious patient, or recent radiotherapy. So these are the different contraindications for the Russian current. And about the different protocols, the current amplitude is 70 milliampere. This is clinically used, but up to 100 milliampere can be used. The most clinically used current amplitude is 70 milliampere. Burst frequency is 50 hertz. Burst duration is 10 microseconds. Sorry, 10 milliseconds. On or off ratio is 10 milliseconds of on, 10 milliseconds of off. The duty cycle is 50%. Ramp up and ramp down is 1 to 2 seconds. The commonly used training protocol for your muscle strengthening, that is here 10 seconds of on, 50 seconds off, and this cycle will be repeated for 10 times. And duration and frequency 10 times daily. It should be used daily for the around 3 to 6 months in order to have a better gain of your muscle strength. And the electrode placement should be parallel to the muscle fibers. So this is all about the Russian current. Thank you for watching this video. Please do share and subscribe this video to your physio friends and fraternity. Thank you.